Medicare. We are so thrilled to have with us Miss Nikki Ward of the Madison Insurance Group. Thanks so much for joining us.
Thank you for having me.
We really appreciate it. This is a very interesting topic for a lot of our viewers that may be on Medicare or about to trying to get on Medicare. So we had a lot of questions from our viewers about this topic. Now you're with the Madison Insurance Group, which is locally owned. It's locations in Clinton and in Oak Ridge. And before we get into all the issues with health insurance, Medicare, if you could just tell our viewers a little bit about your background.
Sure. I've been with Madison. I just celebrated 7 years.
Oh, congratulations.
Excellent. It's a fabulous organization to work for. A great group of folks. We are locally owned and operated. We do act nationally.
Mm-hmm.
We are a broker, so we're not a captive market. So we actually were able to shop people's insurance out, whether if it be your home and your auto, your commercial, your group health, supplementary benefits for employees, you name it, we've got it. We're pretty strong on the work comp market as well.
Okay.
So there's not a whole lot that we don't do. If you can think of it, we can get it done.
Sure,
for you.
absolutely. And what made you want to get into the insurance industry?
Well, I have actually been in the insurance industry for a little bit over 12 years.
Okay.
And I just celebrated, like I said, my anniversary with Madison. And I'm a people person. I like to be out in the public. I like meeting people. I like to help people.
Sure.
And I feel like sometimes people get complacent and they just kind of settle where they're at. And I'm always thriving to make someone's day a little bit better.
Sure. And you touched on this a little bit as far as Madison Insurance Group, but it is a full service insurance company, I suppose.
Most certainly. Anywhere from just home and auto for someone like you or I to, let's say, if it's a large corporation, we can do general liability.
Mm-hmm.
We can cover their buildings. We can do their workers' comp. We can cover their commercial auto. There's not anything that we're not able to help them out with. And typically, because we are such a large brokerage
Mm-hmm.
and we have been around for so long, we have markets that no one else in the state has access to. So typically we're able to save folks quite a bit. I've seen it anywhere from 15 to 35%.
Oh, wow.
Yeah.
Wow. And now you specialize, are you specifically just in the healthcare end of Madison, or do you do all types?
Well, I love working with the senior citizens, and, Medicare is my passion. I do the other lines as well.
Okay.
So, I've been working today on home and auto quotes.
Okay.
And on some different businesses. So I do it all as well, but this is kind of my specialty.
And if one of our viewers maybe have home and auto somewhere else, they can, of course, come to you and get comparable quotes, I suppose.
Of course, yeah. Obviously there's never an obligation. Just call me or call someone at the agency.
Sure.
Let us take a look at what you've got and just do a comparison, apples to apples. Typically, we're able to offer better coverage for a lower premium,
Mm-hmm.
and it's always nice to have someone local.
Yeah, and I always tell people that it's worth a call just to see. You may be paying a lot more, you may not, but it's just usually a phone call to check and see.
Yeah, it's simple. There's no pressure. We've got a great staff. Our customer service, that's something that Madison is really great at.
Mm-hmm.
We have had some ladies there that they're just phenomenal in what they do, and they're great at customer service, and they know what they're doing.
Sure.
And so that really makes a big difference.
Absolutely, and getting on into healthcare, this is an industry that's changed a lot over the last few years. Just as a consumer, I know that with Obamacare. How has the industry changed over the last few years? Is there's still health insurance available for people outside the exchange, or?
Well, yeah, it's not comparable to that, but there
Sure.
are some policies that you can get that are smaller policies. But as far as just the health care, like 5 or 6 years ago, I was able to sell an individual,
Right.
Just a policy with a carrier
Mm-hmm.
that was affordable. I want to say less than $300,
Sure.
that had great coverage. Those are no longer available. You know, and unfortunately, agents, if someone were to call me and if they say, I need health insurance, I've just lost my job and I just need some coverage, I'm not really able to act as their agent, but I will help them. I will sit down with them and help them to navigate that, just to be able to help someone.
Sure. And getting into, you said Medicare is your specialty.
Yeah, it is.
If someone's watching and perhaps they've not been on Medicare, they've of course heard of, everyone's heard of it, but if you could just give us an overview of what exactly Medicare is for maybe some of our younger viewers who.
Well, you know, baby boomers, there's 10,000 people a day, you know, that are aging in or turning 65. And Medicare, it's just, it's a health insurance that's offered by the government to those 65 and older, or those that may be under 65 with certain disabilities. If you've been on Social Security for 24 months through a disability on that 25th month, then you're automatically put onto Medicare. And then, of course, there are just so many different components and rules and regulations. Everyone's needs are different, so everything is just so customized to that individual's needs.
Sure. And you had a lot of information there. I wanted to kind of unpack it a little bit. Who is eligible for Medicare that would be under age 65? Because I guess once you hit 65, everyone is eligible, but who would be eligible under that range?
You know, someone who's had a disability and they have applied for their disability through the Social Security Administration. Typically, that first time it's going to be denied. They have to continue appealing it. But once it is approved and once it actually starts, then they have to be on it for 24 consecutive months. And then on that 25th month, I have seen a couple of circumstances where it was someone who was a child and, you know, they had a disability, and maybe they had survivor's rights from a parent or something like that.
Okay.
I have seen a few cases like that.
So it really depends, I guess, on the circumstance when you start talking about under 65.
That's correct, yes.
Okay. And there's a lot more to get to as far as Medicare. We're going to really start getting into who can get on it, how you apply, et cetera, the different parts of Medicare. We'll be right back after this commercial break. Stay with us.
I am for the child who's had 7 addresses in a single year because she's in foster care, because her father abused her, and her mother couldn't believe her. She is the child I am for. I am a CASA volunteer. I am you.
When it's time for your engagement plan, see the professionals at Peters Jewelers. You will find a huge bridal selection of wedding rings for all tastes and budgets. And at Peters Jewelers, their skilled jewelers can handcraft just about any piece. If you can dream it, Peters Jewelers can make it. Peters Jewelers is a family-owned company with years of experience providing good old-fashioned customer service with attention to every detail. When quality counts, trust the professionals at Peters Jewelers. 1159 Oak Ridge Turnpike in Oak Ridge.
We are ASAP of Anderson, and our mission is to prevent and reduce substance misuse among youth and adults in Anderson County. Prevention is providing information and building skills, but it is also providing support, changing access, changing consequences, changing the physical design of the community, and modifying policy. What role will you play in preventing substance misuse? Find out more at asapofanderson.org.
My name is Sabrina Sumlin, and Healthy Families Tennessee has helped me a lot. As a first-time mom, they taught me a lot about newborn care, and they also helped a lot with development as my son got older. The person that comes is Leona, and she interacts with Jackson so well, and there's a book where she goes through different milestones I should be expecting and ways to deal with terrible twos or just different things, even when he first started eating solid food. And she makes sure to include advice for him as our son gets older, as well as the advice for me. In some of the simplest ways, just as having someone to talk to, When you're a stay-at-home mom and you're at home with a toddler all the time, you don't get out a lot. And so that's one just really simple way.
The United States Air Force has a proud history of leading our nation in embracing diversity. We've been reaching new heights for years by understanding it's our individual experiences which make us strong. You can share in this success by seeking opportunities to learn and grow as a member of a diverse team. We are the world's greatest Air Force, not because of what we do, but who we are. This message is brought to you by the U.S. Air Force.
After doing the reverse mortgage, I found out it's not too good to be true. I can travel now. I actually have a savings account that I was unable to maintain before. And I can do the things that I really want to do. And the house, the beauty of it, it's all true. I own the house, and now it doesn't own me.
Stop by your 10 Bank today, 463-9444.
In Vietnam, we took care of each other.
In combat, you look out for your battle buddy.
I'd do anything for my unit.
When things get tough, it's great to know
somebody's there for you.
Every step of the way.
DAV stands behind America's veterans to make their transition back home easier, with free services and help getting the benefits they've earned. Help us fulfill the promise to our men and women who served. Go to DAV.org to learn more.
Welcome back to This Week in Anderson County. I do want to thank our sponsor this week, Peter's Jewelers, who is having a March Madness sale. It'll be starting here in just a couple of weeks. Go see the good folks at Peter's Jewelers, who we appreciate sponsoring this program. They've done it in the past. Good folks, they'll take care of whatever needs you do have. Please go see them and tell them you heard about it on our show here. Getting back to our conversation with Ms. Nikki Ward is with the Madison Insurance Group. We were just starting to dive into Medicare, which is your specialty. And before we get into the different type of parts, when someone turns 65, is it mandatory that they go sign up for Medicare? What is it?
No, I know a lot of folks that that are healthy, they're still working, and they are covered under their company's group coverage. They don't have to sign up.
Okay.
They will automatically be entitled to the Part A. They do not have to sign up for the Part B. Unless they just want to.
Okay.
A lot of folks, they do just to have that extra coverage to cover their co-pays.
Sure.
With those group health plans, there's larger deductibles, things of that nature. But you're going to be automatically entitled to Part A as long as you have worked for at least 10 years paying taxes in the United States, or if your spouse has. And then Part B, you are automatically signed up. You have to disenroll in it. It used to be where you would have to enroll in it. So now they want you to disenroll in it. And anyone new to Medicare in 2019, the premium for the Part B, the Part A is mostly a zero premium, as long as you have worked those 40 quarters, which is 10 years. The Part B premium, if you're new in 2019, the monthly premium on that is $135.50.
Okay. And so if you do, you are, just to clarify, if you are 65, you don't want Medicare, you can just keep the insurance you have.
Yeah,
I'm sure a lot of people do want it.
Yeah, as long as it's credible coverage, and what that means is just as good as or better than what Medicare offers or original Medicare. And so, as long as you're healthy, as long as you're working, you don't have to sign up on Part B.
Okay. And for people that turn 65 and they do want to apply for Medicare, or anyone that wants to apply for Medicare, can you walk us through that process, what that's like? How do you go to even begin?
Right. Well, you're going to get notifications just a couple of months prior to your 65th birthday month. And they're going to send you your Medicare card, their white and blue card. And it's going to have, let's say your birthday, you're going to turn 65 March the 3rd. Then it's going to have effective date for Part A and for Part B, March 1, 2019. It doesn't matter if your birthday is March 1st or the last day of the month. It starts on that very first day of that 65th birthday month. And then at that point in time, you just really need to sit down with a professional such as myself and just go through what your individual needs are. All plans are different, so what might be good for you wouldn't be good for me. You know, it depends on your medications, basically what your medical needs are. There are so many different types of policies, and premiums are so different. So they're all just really customized.
So it's really about the person's individual needs, getting in touch with the professional, working through it, it sounds like.
That's correct, yeah. It's just sitting down with that person. I take the time. You know, I'll have them come in, bring a list of all of their medications, a list of their doctors, you know, whatever their needs are. We'll sit down. I'll just lay out several different policies and just kind of let them know what their options are and just kind of go that way. And you can actually sign up 3 months prior to that 65th birthday.
Okay. And when, how soon do they know if they're approved? Is that a pretty long process? How does that work?
Well, when you're first aging in or when you're first eligible for Medicare, it's guaranteed issue.
Okay.
So there's no underwriting with that.
I see.
And then, of course, later on down the line, let's say, depending on which policy you pick up, if you change later on, there may be some underwriting, but everyone's guaranteed issue. Okay,
so that's good to know. And Nikki, you talk to so many different people. I know your customers, you love helping them. What are you hearing the most from them about the healthcare industry and where they'd like to see it go? I'm sure they're getting a lot of feedback. What are they looking for in a healthcare plan?
You know, they're looking for richer benefits, and a lot of the carriers, I attend a lot of seminars, and in these seminars they'll ask, you know, what are your clients asking for?
Sure.
And it could be those extra benefits, dental, vision, things of that nature, just better coverages in general. And then, of course, most senior citizens, they are on limited income. So price points, we discuss that quite a bit. So
just
pricing and benefits, you know, everybody just wants more benefits for a lower premium.
Sure. And getting into the different parts of Medicare, and I, again, don't know much about this, so you'll have to walk me through it. We'll just go through it. There's several different parts, but what is Part A Medicare? Okay,
well, Part A, that's what you're entitled to automatically, as long as you've worked those 10 years. And that's your hospitalization. That's like any in-home health care, things of that nature. So basically, it's going to help mostly with your hospitalization. Think of it kind of like as room and board.
Okay.
Per se. Yeah.
Is it sort of like catastrophic insurance in a way? Just hospital visits or?
Well, you know, God forbid something were to happen and you were hospitalized. So under original Medicare, they pay 80%, and then you're responsible for the other 20%. That's where these supplements and for the Medicare Advantage plans come into place.
Okay.
And so that's if you were to turn 65 and just have Part A and Part B and nothing else, that would be just considered original Medicare. And you have to pick up Part D separately. But under original Medicare, they pay for 80%, and you're responsible for 20% of that.
Okay. And getting to the Part B, what would that entail?
Doctor's offices, labs, rehabilitation facilities, of course, any medications, well, not any, a lot of medications that qualify that are administered within the doctor's office. So the different plans have got different benefits, and they're structured differently. So, you know, what one plan may offer a little richer benefit than another plan does. So
Sure. And so the B, you said that's the doctor visits. That's most of, I guess, what most of us that are mostly healthy use is the doctor visits, just your preventative type care.
That's correct.
Okay. And then lastly is Medicare Part D. What can you tell our viewers about that?
Sure. That's your prescription drug coverage.
Okay.
And of course, those are administered by private healthcare companies that are they're regulated by the government, but they are administered through the private companies. So that's your prescription medications. It could be, anything from just your regular low-grade, low-tier medications to insulin. So in each different plan on the Part D, they're all different as well. So there's a lot of components to it. So
sure. And we actually had a gentleman from the pharmaceutical. He was actually worked as a pharmacy rep for some of the smaller pharmacies. Was telling us last week about all the different changes in the prescription drug laws as of late, where they have to. You can ask now for price matching. It was or what the drugs actually cost, which is my understanding you couldn't do that a while back. There was a gag order, I guess, in the pharmacist. Fascinating stuff. It's sort of a lot of different things are going on in the industry right now, it seems like.
With Part D, every year those formularies or drug list, those are changed every year and reviewed. So if a new drug is coming into the market, let's say if something that has been a Tier 3, which was, they had like the strict patents on it or whatever, and let's say I have seen medications that were $110 just 3 years ago, this past year, for $25 because of the generics and the, just the brands and the preferred brands and the different tiers. But luckily, those are looked over every year. And so January 1st is, so let's say back during open enrollment this past season, I sat down with my clientels and we just went over their drug list and what tiers they were, and we were able to kind of see if they needed to make any changes at that time.
Do you get any feedback about the different prices from pharmacy to pharmacy on prescription drugs? Because I found out that was actually quite common.
Yeah, and of course, there once again, it depends on which Part D plan that you pick up.
Sure.
So one pharmacy might have their contract might call for a certain dollar amount for the copay,
right?
And where they might be able to get it, the 90-day a little less expensive. Some Part D plans offer the mail order.
Oh wow! So now that is exactly what it sounds like?
That's exactly what it sounds like.
So you would just actually get everything through the mail?
Yes.
Wow.
Some of them do, but most of your Medicare Advantage plans, they're going to offer that, and so that's where you're really going to get into those rich benefits.
Wow. Well, that's interesting. And now the Medicare enrollment period, what is that? When does it start? How does that work?
Well, there are so many different enrollment periods. Your annual enrollment period is October the 15th through December the 7th.
Okay.
Most of those plans roll out toward the last of August, so that us as agents, we're taking a quick peek at them. We kind of know what's coming up. We're actually allowed to start talking about them on October the 1st. Can't enroll until October the 15th.
Okay.
But during that AEP, October the 15th through December the 7th, you can sit down. We can look over the changes for your policy, see if we need to switch your policy, and whatever you choose will be effective January the 1st, or if you don't want to make any changes, we don't do anything. We just leave it alone.
And Nikki, I know there's probably got to be some costs associated with specifically, I guess, Parts A and B, out of pocket for the Medicare recipient. How do people pay that? How does that work exactly? Or are there costs? How exactly does that work?
Yeah, well, the Part A, as long as you're entitled to that, it's going to be a zero premium. Some folks that are not entitled, they can pick it up. The premium is a little bit more expensive. And on the Part B, when I said the $135.50, that's for folks with some of that can go by your income. So let's say if someone that's making $65,000 a year, 60, they're probably just going to be paying that lower premium. I do have some clientele who are a little bit wealthier, so their Part B premium can be a little bit more higher, depending on that. But if you're drawing a Social Security check, if you decide to go ahead and take that benefit, then you can have that deducted out of that Social Security check, so you really don't miss that money. That's what most folks choose to do. You can have it bank draft, or you can just have a regular paper bill, and I've got several clientele that do that.
And so again, just getting with a professional like yourself and tailoring it to this person's specific needs. It sounds like there's a lot of flexibility with the different types of plans.
You know, Chad, there are, and that's why it's so important to sit down with someone local. I have a lot of folks, and they'll be like, "Oh, I'm just going to call them directly," and I'm like, "But where's the accountability in that?" You know, I bump into my clients at different stores. Of course, I don't want to say any store names.
No,
or whatever. And you know, it's just kind of having that person there, and you just sit down, and there are so many different choices and so many things that are offered that if you're not working with a local professional, that you never know about.
Yeah.
I have sat down with folks that have had the same policy for 10 years, didn't know some of the additional benefits that were available to them at no cost.
Right.
You know, they're like, "Why didn't I know about that?" I'm like, "Because you didn't know me."
Well, you know, I'll tell you that is a common theme that we get on the show a lot, and talking with people either in the insurance industry, in the nonprofit industry. We interview a lot of people where they are helping people like yourself, and it's amazing the amount of benefits, assistance that's available that people are not even aware of. I bet you get that a lot, where people are going, "Wow, I had no idea that I was entitled to this, and I wish I'd known this 10 years ago."
Well, you know, I'm glad that you brought that up because the seniors with low income, I tell all of my clientele, please go see if you're eligible for something. If it's not Medicaid, see if you're eligible for a low income subsidy. That would pay for part of your Part D premiums and medications. So there are so many different outlets that you can go and see if you're eligible for that to help with those premiums and those co-pays and those out-of-pocket costs.
Sure. And I think, like you said, that goes back to using local people like Madison Insurance Group, where you know, if it's a while you all are a national firm, but if it's a national firm, you don't know the people, they're not living in the community, it's informal. You're calling an 800 number, you have no idea, they don't know you. I think it's just a wonderful thing to use local people that, like you said, you do bump into in the grocery store and say, you know, hey, Mickey, I'm not feeling good. I need to, you know, I need to change this, change that.
You know, having that personal connection.
Absolutely.
And having that person be accountable. I had a client give me a call today. They were in the emergency room and they wanted to know what their co-pays were going to be. I was just around the corner, so guess where I spent 45 minutes.
Oh, wow. Yeah.
You know, and that was just, you know, to sit down with them and, you know, just to let them know, hey, it's going to be okay. Yeah, I always tell folks to shop local. You're not going to get that service over the phone. If you do sign up with someone over the phone or on the internet, if you sign up for these policies, do you think you're ever going to talk to that person again?
No, I can tell you you're not going to. I can tell you're not, but I think that's just a wonderful thing. We try to really highlight that on the show. When we come back, I want to talk about supplements, how they work, and just some more stuff about Part D. There's a lot more to get to, Medicare Advantage plans. Please stay with us. But before we go to commercial break, I do want to remind everyone to go see the good folks at 10 Bank. Ms. Lori Wilson, if you're looking for a mortgage or refinancing a mortgage, they'll take care of you like no one else. We do appreciate the good folks at 10 Bank, and we'll be right back with Miss Nikki Ward of Madison Insurance Group right after these messages. Stay with us.
In Vietnam, we took care of each other.
In combat, you look out for your battle buddy.
I'd do anything for my unit.
When things get tough, it's great to know
somebody's there for you.
Every step of the way.
DAV stands behind America's veterans to make their transition back home easier, with free services and help getting the benefits they've earned. Help us fulfill the promise to our men and women who served. Go to DAV.org to learn more.
When it's time for your engagement plan, see the professionals at Peters Jewelers. You will find a huge bridal selection of wedding rings for all tastes and budgets. And at Peters Jewelers, their skilled jewelers can handcraft just about any piece. If you can dream it, Peters Jewelers can make it. Peters Jewelers is a family-owned company with years of experience providing good old-fashioned customer service with attention to every detail. When quality counts, trust the professionals at Peters Jewelers. 1159 Oak Ridge Turnpike in Oak Ridge.
I am for the child who's had 7 addresses in a single year because she's in foster care, because her father abused her, and her mother couldn't believe her. She is the child I am for. I am a CASA volunteer. I am you.
After doing the reverse mortgage, I found out it's not too good to be true. I can travel now. I actually have a savings account that I was unable to maintain before, and I can do the things that I really want to do. And the house, the beauty of it, it's all true. I own the house, and now it doesn't own me.
Stop by your 10 Bank today, 463-9444.
The skills you can develop in the Army National Guard can give you an edge in the high-tech job market of tomorrow. The Guard offers career training to take advantage of your interests in science, technology, engineering, and mathematics. Gain practical experience with emerging technology and equipment that you can transfer to an exciting new field. Get a head start on your career while serving part-time and earning money to pay for college. Visit NationalGuard.com to learn about all of the STEM career opportunities available to you in the Army National Guard.
We are ASAP of Anderson. We are celebrating 10 years of prevention, powered by more than 11,000 hours given by volunteers like you. Together, we've reduced underage substance misuse in our county by 53.5%. Our brand has changed, but our mission remains the same. Prevention works.
Welcome back to This Week in Anderson County. We're having a conversation with Miss Nikki Ward of the Madison Insurance Group about Medicare, hot topic among a lot of our viewers. Just getting back to where we left off, Nikki. You were mentioning earlier about if someone may have insurance and they do get Medicare as a supplement. How exactly does that work? It's doesn't really replace their, I guess, existing insurance. It just supplements it. How does that work?
There once again, if they are on their company's group health and they have Part A, which they're obviously entitled to, and they're paying that Part B premium, which, as we had mentioned a few moments ago, it can be on that sliding scale. It will cover some of their co-pays. Let's say if they did have something catastrophic happen and they were hospitalized, if they had a major life event, heart attack, stroke, a major illness, or even a bad fall. That would just kind of help to cushion some of those co-pays. Sure. For their deductibles and things of that nature.
Okay. And we were talking a little bit before break about the sliding scale, and I know, of course, you can't go into a lot of detail, but it is a sliding scale, I guess, based on income. And if people are interested at home, all they have to do, I guess, is give you a call, and you can go into that over the phone, I guess, with them.
Right. Well, on that Part B premium, that's something that they're really going to, when they talk to the Social Security Department, then they'll know what their premiums for that Part B is. As far as like the supplements and the Medicare Advantage plans, those are pretty much across the board set fees. The supplements, they are age, it depends upon your age. And then, of course, the Medicare Advantage. It doesn't matter if you're, drawing $1,100 a month or if you're drawing $5,000 a month. Those premiums typically across the board remain the same.
It's going to stay the same.
Yes.
Across the board. Okay. And, something that I was thinking about when we went to commercial break was I was kind of speaking as, applying for Medicare, that we pay for Medicare our whole lives, I guess, out of our check. When I get my check every 2 weeks, it comes right out of that. So this is something that people should think about as they've worked their whole life for it.
Yeah, there once again, that goes back to that Part A zero premium. typically, if you're entitled to it, you paid for it. So whether if you sign up for that or not, they automatically issue that to you when you do turn 65. And so, which is a great benefit.
Sure, absolutely. And now, is it true that you get penalized for not having Part D when you become eligible?
As if you don't have credible coverage, so let's go back to if they were on their company's group health policy, and most of the time those policies, they are going to have credible coverage, which means that it is as good as or better than what Medicare standards are. Then there's no penalty. Let's say that you work until you're 71, and then you decide, you know what, it's time for me to retire. I want to lay out on the lake, but you've had your coverage. You're not going to incur that penalty. I had a lady call me just yesterday, and she's actually been on Medicare, Part A and Part B for 6 years. She never has had a Part D plan. So now we're going to get her a Part D plan, but she is going to pay that penalty.
Okay.
And it's 1% of whatever that premium is for each month.
So it goes back to credible coverage. And,
Yes, sir.
and can you kind of, when they come to talk to you, you can kind of tell them what credible coverage is, I guess. That seems like a big term. I mean, could you explain what credible coverage means exactly?
Yeah, that's just whatever. Credible coverage is there once again, whatever it's as good as or better than what Medicare's standards are. So if you have a group health policy and it's got the prescription in that, which most of them do, then that would be considered credible coverage.
Okay. And I wanted to go to a term that we hear a lot about in discussions of Medicare and Medicaid is the donut hole.
Donut hole.
Now, I have no idea what that is. I know what a donut hole is, but I'm assuming it's different.
Well,
so.
it's not a very popular thing.
Yeah.
And so, but that is where what you, as the patient, and what your insurance carrier pay combined, starting January the 1st, what your co-pays and what their cost is, combined up until it reaches $3,820. Then at that point, from that point until $5,100, you're responsible for that medication. But the good part about it is that it is at a reduced cost. Okay. And so some folks go in and out of that donut hole the same month. Some folks might be in that donut hole for a couple of months. But once you do come out of that, you go into what's called catastrophic coverage.
Okay.
And so at that point, you will pay no more than 5% of the retail price for your prescription medications, and then your Part D plan will pick up the rest of that.
So I could see why that would not be a popular thing. I guess is this something you see quite a bit of?
It is, and there are so many misconceptions. People will come in and they'll be like, "Oh, I had this coupon for $500 off on, a certain medication that I couldn't afford, but I wanted to try it, and my doctor has given me this coupon." Well, what they don't realize is that the dollar amount on that coupon is included into those funds.
It's already built in on the front end.
It's built in on the front end, so you're going to reach that donut hole quicker, unknowingly, because you use that coupon.
So I would imagine there's a lot of confused people with that.
There is. There most certainly
sure.
are.
And now, another term that we hear a lot about is something called a Medicare Advantage plan. What exactly is that, and how does that work?
Okay, well, a Medicare Advantage plan, which of course, that would take the place of a supplement and a Part D. So if you just had Part A and Part B, which is original Medicare, and then you would pick up that supplement to take care of that other 20%, you're going to have a premium for that supplement and then a premium for a Part D plan. A Medicare Advantage plan is where it's got the supplement and the Part D built in. And so most of them do offer that. And the Medicare Advantage plans, across the board, let's say if there's one in this area, I'm just going to throw out, and let's just say that there was one in this area at a certain premium dollar. It wouldn't matter if you were 65 or 95. If you lived in that plan's area, then that's the premium that you would pay. And of course, with the Medicare Advantage plan, there are two types of plans. You've got an HMO and a PPO. And so you're agreeing to use that Advantage plan's network of doctors, hospitals, their druggists, things of that nature.
So again, if you could go into the difference between the PPO and the HMO, because you touched on both of them there, but there's a difference, I'm supposing?
Yes, there most certainly are. With the HMO, you are, you choose who your doctor is out of that network. So that's one of those things that's so important to sit down with someone local. And if you came to me and if you said, hey, Nikki, Dr. Smith is my doctor, and I'm not going to change doctors. And if I was showing you a plan that Dr. Smith was not in, but you're not going to change doctors, you're not going to want that plan.
Sure.
And then, of course, so you're going to want a plan that's going to have all of your needs, going to cover all of your needs. So then with an HMO, you do have to have referrals, and you do have to stay within the network. I will tell you, on the Medicare Advantage plans, let's say that you went on vacation and you were in Disneyland for 3 weeks and you fell and had an accident, you would be covered. You are covered when you go out of network in an emergency situation like that. Now, if you have that's an HMO. And that's just a little bit of it. I could talk about an HMO for an hour and a half and bore you to death. But you do.
No, it's fascinating stuff. I mean, this is something that our viewers did have a lot of questions about, because we do have a lot of folks that are nearing that age watching tonight. Right. Now, if they did come to you and they were getting the plan where you did have to stay within the network, could I come to you and say, Nikki, I've been with Dr. Smith for 20 years. Can you tell me if he is in this network on the front end, so you don't get any surprises when it's...
There are no surprises. When you leave me after signing up for a Medicare plan, there's no surprises. You're going to know exactly what you're getting into. We're going to cover all the bases. I'm going to sit down with you. We're going to go through all of your medications. We're going to make sure that all of your doctors and the facilities that you prefer, even down to your hometown pharmacist, if that's what you want to use. So yeah, I mean, there's no surprises. I would never want to sign someone up on a plan that's not going to benefit them.
Of course not. Yeah. And I just didn't know if it was all laid out like that, like you have the network information already on the front end.
Yeah, most certainly, yeah.
Great. And when I think of Medicare, I know it's really good insurance. Some family members I have were on it, that they really pleased with it. But I'd imagine that there are some costs that Medicare does not cover, just with anything else. Is there anything, generally speaking, that Medicare doesn't cover?
Well, if you're looking for a facelift to beautify yourself, it's probably not going to be covered.
Cosmetic surgeries.
Cosmetic surgeries. It's not going to cover your eyewear unless you pick a Medicare Advantage plan, and it's built into that. So there's a couple of them that let's say you had cataract surgery, and once the doctor releases you and says this is the best you're ever going to be, then they will offer you a set dollar amount to get your prescription your eyeglasses, your vision wear, and of course hearing aids, things of that nature. But some plans do have that built into it.
Okay. So again, just getting with someone and just going over and saying, I've got to have X, Y, and Z, you can tell them this is going to work for you, this isn't.
That's right.
But as far as major issues, doctor visits, things that are not out of the ordinary, Medicare generally covers.
Anything medically necessary.
Anything medically necessary. That's a pretty big umbrella then. Yeah, absolutely. And when we get back, I want to talk about the difference between Medicare and Medicaid. And then there's an exciting, I guess it's not brand new, but a newer program called Teledoc that a lot of people that I know have used and had a lot of success with. So I want our viewers to know about this great program, Teledoc. So we'll get all of that when we get back. Before we go to commercial, though, I do want to thank again our sponsor this week, Peters Jewelers. It's not just March Madness in basketball. Peters Jewelers is actually doing a March Madness sale. Go by them, see the showroom, see the wonderful things that they have. They'll take care of you on any needs that you may have for the special someone in your life. Go see them and tell them that you saw it on this program. We can't thank them enough for sponsoring us again this week. We'll be right back after these commercial breaks.
After doing the reverse mortgage, I found out it's not too good to be true. I can travel now. I actually have a savings account that I was unable to maintain before. And I can do the things that I really want to do. And the house, the beauty of it, it's all true. I own the house, and now it doesn't own me.
Stop by your 10 Bank today, 463-9444.
I am for the child who's had 7 addresses in a single year because she's in foster care, because her father abused her, and her mother couldn't believe her. She is the child I am for. I am a CASA volunteer. I am you.
When it's time for your engagement plan, see the professionals at Peters Jewelers. You will find a huge bridal selection of wedding rings for all tastes and budgets. And at Peters Jewelers, their skilled jewelers can handcraft just about any piece. If you can dream it, Peters Jewelers can make it. Peters Jewelers is a family-owned company with years of experience providing good old-fashioned customer service with attention to every detail. When quality counts, trust the professionals at Peters Jewelers. 1159 Oak Ridge Turnpike in Oak Ridge.
We are ASAP of Anderson, and our mission is to prevent and reduce substance misuse among youth and adults in Anderson County. Prevention is providing information and building skills, but it is also providing support, changing access, changing consequences, changing the physical design of the community, and modifying policy. What role will you play in preventing substance misuse? Find out more at asapofanderson.org.
My name is Sabrina Sumlin, and Healthy Families Tennessee has helped me a lot. As a first-time mom, they taught me a lot about newborn care, and they also helped a lot with development as my son got older. The person that comes is Leona, and she interacts with Jackson so well. And there's a book where she goes through different milestones I should be expecting and ways to deal with terrible twos or just different things, even when he first started eating solid food. And she makes sure to include advice for him as our son gets older, as well as the advice for me. In some of the simplest ways, just as having someone to talk to. When you're a stay-at-home mom and you're at home with a toddler all the time, you don't get out a lot. And so that's one just really simple way.
The United States Air Force has a proud history of leading our nation in embracing diversity. We've been reaching new heights for years by understanding it's our individual experiences which make us strong. You can share in this success by seeking opportunities to learn and grow as a member of a diverse team. We are the world's greatest Air Force, not because of what we do, but who we are. This message is brought to you by the U.S. Air Force.
In Vietnam, we took care of each other.
In combat, you look out for your battle buddy.
I'd do anything for my unit.
When things get tough, it's great to know
somebody's there for you.
Every step of the way.
DAV stands behind America's veterans to make their transition back home easier, with free services and help getting the benefits they've earned. Help us fulfill the promise to our men and women who served. Go to DAV.org to learn more.
Welcome back to This Week in Anderson County. Before we get started, I do want to thank our other sponsor this week, which is 10 Bank. Go see Miss Lori Wilson. We had her on the show. She spoke to you about mortgages, refinancing an existing mortgage. If you're at home and you're curious about any of that, you're in the market, give Miss Lori Wilson a call at 10 Bank in Oak Ridge. They'll take care of you. It's worth a call just to see what your situation is. We can't thank Ten Bank enough for sponsoring us this week. Getting back to our conversation on Medicare, Ms. Nikki Ward, you've told us so much about the different types of healthcare plans with Medicare. A few things I wanted to touch on before we got to wrap up here in our last segment is, what are some additional benefits of the Medicare Advantage plans? There's so many, we may have missed a few.
Well, you know, a lot of these plans, they have additional benefits built in to make them more attractive to the consumer. Some of them have gym memberships.
Oh, really? Wow.
Yeah. Some of them will offer, you know, 24-hour nursing lines. Some of them will offer a little bit of dental built into them. Okay. You know, a lot of them offer, it's an over-the-counter benefit. And that's one thing that's so commonly, you know, that I'll be talking to someone who's had that plan for years, and they didn't realize that they could order through that mail order, you know, whether it be toothpaste, Band-Aids, Neosporin, Nexium, whatever it is, of course. So just a lot of rich benefits built into some of those plans. And, you know, but that 24-hour nurse hotline, that is definitely something that those Advantage plans are really starting to get
absolutely. I can just imagine a situation that, you know, maybe after midnight, someone's sick, they don't really want to go to the emergency room, but they feel like they need to do something, get some sort of care. That's a really good first step, it sounds like.
Yeah, I mean, you know, a lot of these senior citizens, or even the ones that are under 65 and are disabled, a lot of them, they live on their own. And it can be a scary thing when you're sick and when you're home by yourself, and you just want to have some questions answered before you know, make that call to EMS, or, you know, get a loved one or a neighbor out of the bed in the middle of the night. Sure. And so those are well used. And a lot of the Medicare Advantage plans, a lot of people will think that they're getting telephone calls from carriers trying to solicit. A lot of times they're calling just to check on you.
Oh, really?
Yeah. And so depending on your health needs, they'll have a nurse that's assigned to you that will actually give you a call and see how you're feeling, how your meds are working, things of that nature.
Wow, that's an incredible resource, especially in those situations where you say someone maybe is elderly, living alone. You actually have someone calling to check on them. That's an amazing resource. People, I didn't know that was out there.
Yeah, and you know, if you're hospitalized, you know, there's some services that are available to you once you do come home from that stay. So, you know, there, once again, it really just depends on the plan.
Sure. So
that's why it's so important, you know, to sit down, and I really like to get to know someone and see what their needs are. Sure. Because, you know, I want to help people.
Absolutely, and I want to get into the teledoc program, which we touched. We told our viewers we were going to get into. What is the teledoc program for people that have never heard of it?
Well, you know, I'm so excited about this program. Unfortunately, healthcare right now is so expensive for the individuals if they're not working with a company that offers the major group policies, and they just simply cannot afford insurance through the exchange, through the Affordable Care Act. And this doesn't really replace anything, but it's just a policy that you pay for on your own, and you have 24/7 access to a physician on the phone, or through Skype, or email, or just there are several different ways that you can reach out to them, and it's so affordable.
Now, that doesn't replace your doctor. It's just an added service, is what you're saying?
It's an added service, and a lot of employers are gearing toward offering this because that saves them on their co-pays when they go to the doctor. Or, you know, if you have an employee that's homesick in the evening, or a sick child, instead of running out to the emergency room or them missing time off of work, they're able to call, speak with a physician, you know, if they can, you know, give some sort of a diagnosis over the phone, and have a